This we talked about, I mentioned it briefly, this is a sebaceous gland. So this is a lobule, a cluster of cells together, and these cells have a very different look than anything we've looked at yet. Each individual cell has a tiny little white space in it. Those little white spaces are also artifact. This is because there used to be lipid or fat in here. So each cell, here's one whole cell. This one right here is one cell. It's got a nucleus, the little purple thing, and then all of the cytoplasm is completely filled up with these tiny white little bubbles. And these are perfectly round because these were fat, and the human body is made up of water, and when you mix oil or fat with water, what does it do? It makes perfectly round little droplets, little spheres. So anytime you see a perfectly round little white circle inside the body, it's usually a good sign that you might be dealing with something that was fat that's been dissolved during processing, because fat only can make little perfectly round droplets. So these cells are called sebaceous cells, or sebacites, and their cytoplasm is filled with little tiny vacuoles of fat. And when these cells, we'll look at it in another section, when these cells all break down, they squeeze out of the gland into the hair follicle, and they make a type of secretion called sebum, or sebaceous secretion. And so anyway, these are sebacites, and this is a sebaceous gland. And around the outside of the gland, the cells are a little bit more blue and what we call basaloid. So that's kind of what we call the germinative layer. They're like the layer of cells that give rise to the more mature sebacites. And then as the cells mature, they pick up lipid in their cytoplasm and become more white and bubbly looking. All right, so that's a sebaceous gland. Over here you can see, this is nice. So here is a hair follicle. Let's go to lower power. And you can see that this is a follicle, but it doesn't look like it connects the surface. And that's one thing that's a little bit hard for some people to learn about pathology, is you have to think a little bit. We're looking at a two-dimensional slice of three-dimensional tissue. So that follicle definitely connects up to the surface. You can kind of see the top of it up here. It just kind of is out of the plane that we've sliced through. So if you sliced a little deeper, you might see where it actually starts to connect up to the top there. So you have to get kind of used to looking at pieces of things that aren't always perfectly showing the entire detail. But here you can see kind of the base of one of these hair follicles, and in the center, this little piece right here, that if you kind of put your finger underneath the light, you can kind of see it kind of move in and out. That is actually the hair shaft. That's a hair shaft. That's what your hair looks like inside your skin. And the follicle is this layer of epithelium surrounding the hair shaft. And you can see the sebaceous glands, one here and one here. Their job is to drain straight into and kind of coat the outside of the hair shaft. And so the sebaceous secretion will drain into the follicle and come out of the top of the follicle onto the skin surface right around where the hair shaft exits. And see, here's the opening of the follicle. So we'll look again at follicles in a minute. So we've covered many of the structures. I think we have one more I wanted to show you in here. Yeah, these. So this, I said earlier, I showed you that this is a sweat gland. This is an eccrine sweat gland, the kind of liquid, like watery sweat that you get when you get sweaty palms if you're nervous. That comes from these glands, and these are called eccrine glands, or the word we often use is the eccrine coil, because what it is a simple little gland, a tubular gland, that's all tangled up into a coil. And it makes the sweat, and then the sweat is secreted out through this little tube called the duct, the sweat duct. And again, you can't see how this sweat duct travels all the way to the surface. It kind of seems to disappear, but it goes all the way up to the surface and empties out. And if you look around, we may be able to find another one where another one empties out, or maybe we won't. Maybe this piece of tissue doesn't have one. You don't always see every structure that you're looking for on every piece of tissue. All right, well, we'll have to see one in another piece of tissue. So here, these eccrine coils, they have a unique kind of lining. They're lined by a double layer of cuboidal epithelium. So cuboidal cells have round nuclei and kind of are slightly square or cuboidal in shape. Now, I know you have to use your imagination to think that these are square, but they're kind of, they're not taller than they are wide, like a columnar cell would be. So you can see that they have these round nuclei, and there are kind of two layers of them. I think you can best appreciate the double layer here in the duct. So you can see the double layer here. The inner layer is this layer right here that's more pink. And then this outer layer, which is actually made of a special cell type called myoepithelial cells. They kind of have a little bit of contraction properties, supposedly. I don't know how much of that gets actually used here, but they do have some contractile filaments in them. So they have a little bit of muscle-like quality. So anyway, that's the myoepithelial layer on the outside, or the basal layer, some people might call it. And then the inside is the apical layer, these larger nuclei with pink cytoplasm. So it's a double layer of cuboidal cells. And really, I think there's only two places really you see that in the body that I can think of. I'm not a histology expert, but I do look at a lot of tissue. You see them in the ducts of sweat glands, and you also see them in the ducts of the salivary glands. You can see kind of a double layer of cuboidal epithelium. And that's, I think, because the sweat glands and salivary glands have a lot of things in common. And when you get tumors in your salivary gland, they tend to have a lot of overlapping features with tumors that grow in the skin from sweat gland origin. And this is a good example of, this is the lumen, the center part of a gland or a center part of a vessel, that empty space we call lumen. So this is a lumen, and then here's the sweat duct. And out here as a comparison, this is a blood vessel space. See, it's got a red cell in it, and it's got one layer lining it. Well, you might say, well, what about this outer layer here? That's actually, those are modified smooth muscle cells called pericytes. And that's a little thin layer of muscle around the outside of the vessel. So if you did different special stains, immunostains, you could show that this is made of epithelial cells, and this is actually made of endothelial cells and muscle. Okay, let me show you a different slide here. This is from acral skin, which is the thick skin on the hands and the palms and soles of the hands and feet. And down here you can see the eccrine coils, the eccrine sweat glands down there, all of these over here. And I have another video I'll make about acral skin specifically, and you can go check that out. I'll put a link down below. So this is a nice example though, where you can see the coil, the eccrine coil, which is the part that makes the sweat secretions, and all those tubules are tangled together. There's another clustered coil over here, and then you can see the gland eventually comes. Here's another one. This gland here, you can see the gland part. The cells look a little bit different. They're like a little more pale. And then over here, it's turning into the sweat duct, right? Where the cells kind of have like a slightly more purplish color to their cytoplasm, and they take on that nice double layer appearance that we talked about. Okay, and you can follow this sweat duct as it goes from the eccrine coil, the sweat producing portion of the sweat gland, and then it turns into the duct, and then the duct kind of winds and twists its way all the way up until it empties out on the surface. So you can't see the whole thing because it's kind of curving and twisting. We're only seeing the parts of it that are in the plane of the section of tissue that we're looking at. Closer look at the gland component and then the duct component. And as we get to the top, you can see this part here. This is called the Acrosyringium. This is the part where the eccrine duct empties out through the epidermis and allows the sweat secretion to go out onto the skin surface, okay? And it depends on the angle of sectioning or cut. The acrosyringium can have a different appearance, okay? Sometimes it's very spiraled and you see multiple little cross sections of tubules. Sometimes it looks like it's coming kind of straight out. But here you can see there's a little bit of sweat duct, see? And here it's connecting to the epidermis, even though you can't see the lumen, the little center part, you can't see here because we've not cut quite into it, right? Where if we cut a little bit deeper into the tissue, you'd see that lumen there. And then closer in here, the lumen shows up again. As it comes out, there's some little granules. Some of those keratohyalin granules are getting into the opening. And then here it empties out onto the surface. And in acral skin particularly, that's the best place to see these acrosyringia. That's the plural. Acrosyringium is singular. Acrosyringia is plural. Here's another one right here. There's the duct. It's going to connect right there and come out. Here's another one next door to it. So in palm and sole skin, you have a lot of eccrine glands and, of course, a lot of eccrine ducts. And also, it's kind of cool. You can see the here's the duct down here, kind of cut at an angle, so it looks like it's coming straight out of the tissue at us. But this one probably goes swirls around and connects up somewhere deeper in the tissue. And you can see, look at this. That's what happens when it empties out into this thick stratum corneum. In the acral skin, particularly, you see this. You can see little tiny holes in the stratum corneum, which correspond to the space that the sweat would flow through to get out to the surface of the skin. So next time you have, sweaty palms because you're nervous about something, think about that this is the process that's happening here. The sweat's coming out through these little, spirally tubules called acrosyringia. So I always think these are pretty cool to look at, and you can see the color of the stratum corneum kind of changes right around the opening here. There's the keratin is kind of a different pattern here. See, there's more of them. So they're everywhere. And then here's more angles. See, this part of the tissue is folded a little bit, so instead of cutting straight up, we're seeing the ducts kind of look like they're coming straight out at us instead of going longitudinally up towards the surface. All right, so that is eccrine coil, eccrine duct, and acrosyringium. And while we're at it, I've got another picture that shows here's what it looks like in non-acral skin, and you can see this one. You can see this is all just one acrosyringium, one sweat duct emptying out to the surface, but we got a perfect section, and you can see it's kind of spiraling, and as we cut straight through that spiral, you see one cross-section, another cross-section, another, and see that little pink lining? That's typical of the sweat ducts. They have this cuticle, that pink lining that lines the inside of the duct. Here's a closer look at that. So that is the eccrine duct emptying out to the skin surface. And this is not normal skin here. This is an actinic keratosis, which is a precancerous lesion that arises in people who've had years and years of chronic sun damage. And some of these go on to develop into squamous cell carcinoma. I have a whole video about actinic keratosis and squamous cell carcinoma that you can check out. But what's interesting is that in actinic keratoses, you get the atypical cells here in the epidermis, and then here and here they're down the basal aspect. The lower aspect of the epidermis is atypical, and then they mature to the top and make a big, thick layer of parakeratosis up there. That's beyond the scope of this video, but look at how they spare the acrosyringium. And so you can see that sweat duct coming out with its pink cuticle lining, spiraling through the surface, and then up into the stratum corneum. And this keratin here is normal, and everything around it is way thicker, and it has nuclei in it, which is parakeratosis. So that's all abnormal due to the actinic keratosis, but the actinic keratosis spares the sweat duct opening. Here's another one over here. So it's a nice feature to really highlight the appearance of the acrosyringia. All right, let's look at this piece of skin. This looks really weird up here because it's totally folded tissue. The skin's folded over and wrinkled, and so it gives us this crazy looking epidermis, but that's all an artifact of sectioning in the laboratory. But why I'm showing you this skin is a nice example of a different type of sweat gland, and these are called apocrine glands. Apocrine glands only occur in certain sites in the body. You have eccrine sweat glands pretty much everywhere, but apocrine glands tend to be in the axilla, the armpits, the anogenital region in the groin, and also in a couple other sites like the areola, right around the opening, right around the nipple, the areola, and then also on the margin of the eyelid, where they're called the glands of Moll, M-O-L-L. Those are the main normal places that you see apocrine glands. And apocrine glands, I like this slide because you see apocrine glands here, right here. This is the apocrine glands. And then over here for comparison is eccrine coil or eccrine gland. The apocrine gland cluster itself is way bigger usually than an eccrine coil. So an eccrine coil is about this size. Apocrine kind of coil, I guess you'd call it, is like 5, 6, 7, 10 times bigger. Okay, that's number one. Number two, the actual individual luminal spaces are way bigger. These have little small lumens, small spaces in the middle. The actual tubules here in the apocrine glands are much larger and have much more dilated central spaces in general. And then the cells actually look quite different when you look closer, but from low power you can tell because these are very big, very pink, much more dilated. See? Eccrine, apocrine. And then the characteristic feature that everyone learns about apocrine is that they've got these little snouts, okay? They've got these little apocrine snouts or little kind of noses or finger-like projections protruding into the lumen of the gland space. And the thought in the past was that what happened, how these glands made their secretion, was that these little blebs or snouts would get pinched off, like it looks like it's happening there, right? It looks like they're falling off into the secretion, into the space, and the secretion was formed from little pinched off, dead bits of the apocrine cells. But more recent studies, my understanding at least, is that more recent studies from using electron microscopy have shown that that's actually not what happens here, despite years and years of being taught this. I had always been taught this and only learned this a few years ago. But actually the secretion method here is similar to the secretion method in eccrine glands, which is merocrine, that the little vesicles of secretion come to the cell membrane and fuse with it and release their contents across the cell membrane into the luminal space, which then makes the secretion, okay? And the secretions from apocrine glands, I believe, can be acted on by bacteria on the skin surface, and that contributes to the production of body odor. A couple other things, though, that are different, that are worth noting about apocrine cells, in addition to their little snouts. Look how bright pink their cytoplasm is. They have very bright pink cytoplasm, and it has kind of a granular appearance. I'll show you some other pictures in a minute that really highlight this. Sometimes you can see some kind of brownish yellow pigment. I believe that this is lipofuscin, which is kind of a wear and tear breakdown pigment that we see in different cells in the body. Whoops. And you sometimes see that in apocrine glands. And then the cytoplasm is kind of a granular, grainy appearance. Again, I'll show you that on a different picture. And the nuclei are much bigger than those of eccrine glands. They're large and they're very perfectly round. And let's see if I get the focus here. They tend to have prominent central nucleoli. They look like little eyeballs staring at you. They look like the one-eyed minion, from the Minions movie. I can't remember his name. But in any case, that's what they look like. Someone told me that on Instagram a few years back, and I thought that was so cool and accurate. So anyway, all those are the features of apocrine glands. And then again, looking closer over here for comparison, eccrine glands. The cells are much smaller. They are not as perfectly round. The cytoplasm is not as bright eosinophilic, pink color, and you don't have those big, large nucleoli. You might have some little tiny nucleoli, but they do look quite different, okay? So the reason it's helpful is, number one, if you haven't seen apocrine glands before, you'll be like, what are these? Because they look so dramatic. I think they're quite beautiful. I love seeing apocrine glands, actually. And then also, the other reason to know about them is that if you see them, you have an instant idea that you're in the anogenital area or the axilla or one of those other special sites. If you see apocrine glands in sites other than that, like say I see apocrine glands on the scalp, I'm going to think about certain diseases like nevus sebaceous, which is a hamartomatous proliferation that grows on the scalp that tends to produce apocrine glands in the scalp where they're not normally supposed to be. And I've got a video about nevus sebaceous you can check out if you want. These are apocrine glands over here, although they've become a little atrophic. I think they're blocked off up above because this is in the background of another pathologic process that we're not going to get into in this video. So you can see a little bit of secretion here. The duct of the apocrine gland, I don't know if we have any here, they look just like eccrine ducts, actually. They don't have this apocrine look. They just look identical to my eye to the eccrine ducts. The difference is that eccrine ducts drain to the skin surface, whereas apocrine ducts drain into the hair follicle. And only very rarely have I actually got a perfect section where I saw an apocrine duct draining into a hair follicle. But I don't know if I actually have a picture of that or not. I'll have to go dig through my files. But here we go, apocrine glands. And then look, there's a little root of a hair follicle here. Just to show you what that looks like. Here, this is a little duct. That could very well be an apocrine duct, or it could be an eccrine duct. I don't know. The only way to know is to see it attached to the apocrine gland, or to see it attached to the hair follicle lumen, or the hair follicle itself, rather than the skin surface. Otherwise, if it's in the middle of the dermis, it could be either one. Okay. Now, let's look at some more pictures. All right, so it's kind of to reiterate that this is a good example of how big and round the nuclei are and how prominent those central nucleoli are. And look at the really bright pink granules. These seem to always be present in apocrine secretory cells to me, but I think that every once in a while they stand out much more vividly, and I think it depends partially on the quality of the hematoxylin and eosin stain from case to case, or maybe the fixation or something else. So this was a particularly beautiful example I saw. Like I said, I really like apocrine glands. You're probably tired of hearing about them now, but you've come this far, so go ahead and keep watching. Here's a closer look I think I took these with my iPhone, so they might be a slight bit blurry, but in general, iPhones take pretty awesome pictures just by holding it up to the ocular of the microscope. It takes a little practice, though. Here's another one. This one's a little more flattened and doesn't have those nice snouts, the Apocrine snouts. So just so you know, you don't always see those. And you can see also some of that lipofuscin, that golden kind of pigment in the cytoplasm. And there are some conditions where people can get pigmented sweat, actually, and I believe it's from lipofuscin, from the sweat secretions getting into the secretion itself and causing pigmented coloration of the sweat. And here, this is just for the sake of pure beauty. This is a PAS stain, periodic acid shift stain. We usually use this to look for fungus or occasionally for certain types of other inclusions and depositions. Here, this was just, I think, control tissue that happened to have a beautiful apocrine gland, and I was blown away by how amazing apocrine glands look when you stain them with PAS. With diastase, which dissolves away glycogen and the sugar molecules, but leaves behind other substances. So number one, the granules that I pointed out earlier, they brightly highlight with PAS. And then also look at this cool little spiky bottom here. This is the basement membrane underneath the cells, which is made of collagen type 4. And here you can see where the basement membrane kind of comes up and invaginates in between each individual cell, kind of cups around it, which gives a really cool kind of striped sort of appearance. I just thought was quite amazing and beautiful. If you don't think this is pretty and don't like this, I don't know what to do to make you happy. So hopefully you enjoy this, or if not, at least you get a laugh out of how passionate I am about apocrine glands. And there's those granules